Hello, this is Dr. Jaideep Chaudhary with Academics in Nutshell. Frequently asked questions on influenza vaccine is the topic of discussion. When and which flu vaccine for India? Well, geographically, India is within the northern hemisphere, but it behaves more like the southern hemisphere, and that's why WHO also recommends southern hemisphere vaccine for India. The ideal time for influenza vaccination, considering the influenza season, is pre monsoon, that's around April and May, which is also the southern hemisphere cycle. At a point of time when both southern and northern hemisphere flu vaccines are available, then which one to select? Ideally, one should not wait for the next southern hemisphere season to arrive. So, whichever is the most recent vaccine, it should be administered. Then, by the next year, the southern hemisphere cycle can be started. There are split and subunit vaccines. Which one to choose? Practically, there are not much difference in efficacy among these two vaccines in children. Theoretically, split vaccine is said to be more immunogenic in younger age group, though it may be more reactogenic as it contains both the inner and outer proteins, and subunit vaccines contain only the outer protein, hence less reactogenic. But still, either of the split variant or subunit vaccine may be used. A 1 year, 8-month-old child has taken only one dose of flu vaccine last year. How many doses this year? A single dose in the initial season. This child should receive 2 doses in this season and subsequently yearly single dose. A 4-year-old child has received 2 doses of flu vaccine in the first year, then missed the subsequent yearly doses. How many doses now? Because the child was primed with 2 doses initially, so only 1 dose in this season and subsequent seasons are adequate. A child has recovered from PCR positive influenza. Does he need a flu vaccine and when? Yes, this child definitely needs. There are 4 strains of influenza in the vaccine and it can protect from other strains also. But the vaccine has to be given only after clinical recovery. A subunit influenza vaccine was given in the last year. Can a split vaccine be given this season? Though as for any other vaccine, ideally the same composition should be continued. But yes, in this case, it can be given. The interchange between split and subunit is permissible. And the most critical question from the parents. Every year we give flu vaccine. Still my child suffers from cough, cold every 1 or 2 months and occasional fever. Should we continue flu vaccine? Well, we have to explain that common cold is not due to influenza. It's due to many other viruses and influenza causes much serious illness. So flu vaccine should be given yearly. Thank you. See you again.